It's time to take 5. Now you know.
So much needs to be done to battle the opioid crisis. One solution is to remove pills from the treatment process and to look to alternative methods, such as interventional pain management, which gets to the root of the problem instead of just masking the symptoms with medication. With us today is Dr. Alejandro Tapia of Physician Partners of America. Welcome, Dr. Tapia.
Thank you for having me.
Can you explain what interventional pain management is?
Yes, that's the use of treatments and interventional procedures to get to the root cause of the pain, take care of the pain without using medications such as opioids.
And what kind of conditions can you treat?
We can treat anywhere from spinal stenosis to degenerative disc disease, arthritis, and neuropathies.
Now, I know one procedure you perform is a spinal cord stimulator implant that I hear shows a lot of promise.
Yes.
Can you explain how that works?
Sure, that's a device that is placed in the spine. I've got some models here. We put a small lead, such as this, inside the spinal canal. And what it does is uses electricity to interrupt the pain signals from reaching the brain. It's all done through a needle that's placed under fluoroscopy, so that's a live x-ray, so it's very safe, done in an outpatient surgery center. It's all outpatient surgery, same day you go home. We do a trial for about a week to see if the system provides enough analgesic relief for the patient. If the trial is a success, then the system is implanted permanently. And this is about the size of the battery. As you can see, it's very small. And we place that right under the skin, collect the wires, and the wires go into the spine.
Now, will this spinal cord stimulator allow the patient to be free of medications?
We can see that technically we can wean them off their medication. Ideally, it would be completely off, or at least get them to taking a much lower dose than they were currently on. Can
the patient control the stimulation therapy?
Yes, they're given a little remote, and they can turn it on, turn it off, make it stronger, make it weaker. They can change the programs that's implanted in them.
How will the spinal cord stimulator impact diagnostic imaging of the patients?
As of today, they're MRI compatible, so you can go ahead and get any imaging that would be needed in the future.
Can the patient actually feel the implant, and is it visible to others?
It's not too visible. It's kind of like you'll see a little scar from the device, but it's not really. As you can see, they're very small and thin, so it's almost hardly noticeable.
Probably the most important question: is it safe?
Yes. It's all done under a live x-ray, so we see exactly what we're doing and placement of the leads and the generator.
And how do you charge that internal battery?
Well, there's two kinds of batteries. There's one that doesn't need charging and will last anywhere from 5 to 7 years, and then there's the rechargeable that, depending on the parameters you have it on, you can recharge from every 3 days to every 5 days, and it takes about anywhere from 15 minutes to an hour.
Is there like a trial period before it's actually implanted?
Yes, we generally will do a trial for about a week in which the patient comes in, we do the procedure, put the leads in the spine, but their generator will be then worn externally. And then there again, they're given a little remote. They can control it, they can turn it off, make it stronger, make it weaker. And they're in constant contact with our office or the representative of the company who gauges how they're doing.
And is this procedure done outpatient or in the hospital? It's
all done outpatient, same day surgery, you go home same day, and recuperation is, after the implant, if it's a trial success, is usually a few days.
Can you share some of the success stories from your patients who have undergone the spinal cord stimulator implant?
Sure. I had one patient that she presented to me, she had spinal fusion surgery, was using a walker, hunched over was the only way she could walk around. The day of the spinal cord stimulation, we put it in. She walked out of the surgery center upright without her walker.
That's incredible.
Yes, she was very happy, and we've begun titrating her off her medication.
Thank you so much, Dr. Tapia.
Thank you.
To manage your pain without the use of opioids, call Physician Partners of America now for a same-day appointment in Wellington or Boynton Beach. Their number is 855-208-PAIN, or you can visit them online at ppoamedical.com.